Hello, I'm Ken Cutbush, a shoulder surgeon working in Brisbane. This is Lucy Angelini, physiotherapist. Lucy has a tremendous amount of experience looking after patients with shoulder issues and treating shoulder patients. I'm here talking with Lucy today regarding rehabilitation associated with a reverse total shoulder replacement. So we're going to start off talking about the preparation for the actual surgery itself. So before you have the surgery, the prehab we call it, we will go through what to expect in hospital from day one post-op and that early phase while you're still in the sling. My patients are normally in a sling 3 to 4 weeks after a reverse shoulder replacement. So we'll talk about that phase, and then the phase when you start to wean out of the sling in the 4th week through to when you come to see me at 6 and 12 weeks post-operatively with one of the physiotherapists who may well be Lucy. And then we'll talk about that later phase from 3 months onwards. Welcome. Thanks for coming along.
Thanks for having me.
So we're going to talk to everyone about the prehab, preparing for the reverse shoulder replacements.
Yeah.
What advice have you got for them?
So there's quite a few things that you can focus on with your physiotherapist before your surgery. One of the important things is your posture and the position of your shoulder blade. So having an awareness of where your shoulder blade is in space. Oftentimes a shoulder that's been sore, the shoulder blade tends to tilt anteriorly. So having an awareness of where that is because you're about to go in a sling.
So what is it? Shoulders back and chest up?
Back. Lifting your chest, is all very important. And then another thing that you can work on is your range of motion. So especially your external rotation is important to try and get as much external rotation before you go into the sling. And then the other thing that's important is your strengthening. So especially your external rotation strengthening and also strengthening of the deltoid muscle because that, as you know, becomes the prime mover once you've had the reverse total shoulder replacement.
And I can imagine that's pretty hard sometimes for a lot of people because the shoulder's sore. Otherwise,
Absolutely.
why would they be having shoulder replacement?
Absolutely, yeah. So you can work with your physiotherapist and find out the best way that you can do that in a relatively pain-free kind of fashion. Yeah. But the more range and the more strength you have going into the surgery, the better your rehab's going to be.
And we can talk to their physiotherapists about
Absolutely.
the rehab plan, can't we?
Absolutely.
If they're not sure or they want to see exactly what we have. So we can, my office will be able to help you with that. We can send a sketch of the or a program out to your physiotherapist so that they know what we like to do in terms of preparing for the reverse shoulder replacement. Because remember, your physio may not be seeing lots of people with reverse shoulder replacements, so we're always keen to work in with your physio. So just to recap, prehab.
Prehab, so scapular positioning.
So shoulders back, chest up.
Yes. Range of motion, so maintaining especially that external rotation.
External rotation.
Yep. And then strengthening, so getting your external rotators nice and strong and your deltoid muscle as well.
Yeah. And even if it's hard to do the exercises, actually looking at the exercises before the surgery and getting an idea of them actually does help post-operatively, doesn't it?
Absolutely, yeah. The
so
more
you know what to expect.
familiar you are with them, the better.
Yeah. And I guess I might just put in with the external rotation. It's very easy to do external rotation like this with your elbow coming away from your body. External rotation, what we're really looking at is the elbow touching the ribs and then twisting out from there. And that's something to watch. Your physio can help you with that and make sure you're doing it right. So that's just a tip there. So from prehab, we're going to go on to talk about that early post-op period. I think it'd be good to talk to them about that day one post-op, wouldn't it?
So you'll be seen in hospital by one of the St Andrews physios and they'll instruct you as to the best way to get in and out of the sling, how to use your shower sling so that you're independent with those kinds of things. And they'll give you some gentle passive range of motion exercises. So a gentle pendulum, a gentle passive external rotation and some bench flexion. So they're just to maintain what range we can while you're in that early healing phase. And then we also like to move the adjacent joints. So we keep your hand and your elbow and your neck moving just to make sure they don't stiffen up as a result of being in the sling. So it's fairly low key in terms of the exercises. We don't need you to push it and make the shoulder super sore, but we like you to maintain as much range as you can within the set limits.
Right. So and just so you know that the rehab program that the shoulder physio in hospital is going to show you is one that Lucy and I have designed. So that is they stick on the same page and with us, so that we work very closely with all the physios we deal with. Shall we go through what a pendulum exercise looks like?
Sounds good. Yeah.
So what do I do?
So you're going to support with your non-operated arm.
This one?
Yep.
So my surgery's on the right arm, hey?
Right, yeah. And then you're going to bend forward from the hips as if you're reaching down towards
Am I doing it right?
That looks really good.
Right.
You've done it before?
Yep.
Yep. And then you can do some gentle circles.
Just little circles.
Yeah, just about the size of a saucer.
And you do it one way and then the other way, don't you?
Alternate directions.
And how many circles?
So about for a minute, alternating directions.
Okay.
Yeah.
How am I going? Do I have to pull my shoulder back?
Then you just want to make sure that your shoulder's sitting nicely on your chest wall.
Right, so shoulder back and up.
Yeah, exactly. Yeah.
Any other tips?
Good. So just just let it. It's passive, so you just want to make sure it's nice and relaxed. You don't want to feel like you're holding it too much.
Right.
Yeah.
Then the next one?
So the external rotation. Oh yeah, the flexion. Yep.
Do flexions. So both hands?
Something about waist height.
Yep.
So a bit higher than this.
So probably a bit higher than this, but we'll just use this to show.
And shuffle your feet back.
Shuffle my feet back.
And then gently poke your hips out behind you. Yep. Just the point of nice stretch.
Yep.
Not pain.
And we're just going to 90 degrees, aren't we? Between your torso and your shoulder, is that
we
right?
Measure the angle between your arm and your trunk.
Yep. So this is about right.
90.
Good.
Yep, perfect. And then hips in and then walk in.
Come back and walk back up.
Yeah. And again, it's passive, so you want to keep.
And how many of those do we do?
So we hold it for about 10 seconds and we do it 5 to 10 times.
All right.
This is all written down for you.
Yes.
You don't have to remember. Yeah.
And then external rotation?
External rotation, so passive external rotation.
Yeah.
So using the stick.
And the physios will show this. So this will be done with the physios, won't it?
You'll go through it with the physios. And you'll stand either in a doorway or have a towel in close to you so you can keep your elbow on your ribs like you were speaking about before.
Yep.
Using your good arm to give the operated arm a gentle
that.
stretch out to the side. Really making sure your shoulder blades in that nice up and back position. Yeah.
Great. All right. So that's just a rough guide, just give you some idea. Obviously, you'll be doing it with the physio in hospital, but it's good to know what you're actually going to be doing and have some idea and be prepared for it. Now, you mentioned the hospital physio will go through with everyone how to put a sling on, how to put a shirt on, how to put a shower on.
Yeah, exactly. How to have a shower, how to put on deodorant, how to get dressed.
And you and I have done them already, haven't we?
We have.
So Lucy and I have done these videos and they're on the website too. So those initial ones, and they're what a lot of people, well, it's a common question, isn't it? How to put a sling on.
Absolutely.
So that's on the website. How to have a shower is on the website. How to put a shirt on safely is on the website as well. So those videos are on the website, so you can have a look at them before you go into hospital if you'd like to, and certainly they're there for later.
Absolutely, yeah.
You'll see Lucy in them.
So you'll be in the sling for the first 4 weeks. You'll be doing these gentle exercises. When you're sleeping, a lot of people find being a bit more propped up in bed is more comfortable. Some people sleep in a recliner chair for the first few weeks just because they find that more comfortable. But sleeping with the sling on and sometimes with the pillow behind the elbow to help prop it up.
To push it forward a bit.
Yeah, just so it feels more relaxed.
Yeah, right.
Supported.
Okay, good. And the physio will also, this is something that I see, because we fit the slings with people lying down on the theatre table, they actually need to be fitted with you, properly fitted. They need you standing when they're fitted. So that we can't do that while you're in theatre, obviously. That has to happen once you're awake the next day. And the hospital physio will do that for you the next morning. So you'll be standing up and they'll fit the sling properly for you. So it's not key that first night. As long as you're in the sling, you've got the bolster there, you'll be totally fine for that first night.
And don't panic if you roll onto it. Might be a bit sore, but you won't have broken it.
Yeah, no, that's something people ask me too. No, the whole construct is solid from the beginning, and it's not that risky and it's not that fragile that you'll roll onto it and hurt it at night time.
That's great.
Any other tips before they leave hospital?
I think that's covered all the main things. But if you have any questions, just always get in touch.
Yeah.
Shoot us an email or, we're happy to answer any questions.
Yeah, Lucy and the other extended physios are available for those questions. And of course, the hospital physios are very experienced and see lots of my patients with shoulder problems. So just to give you the recap, just in terms, the usual thing is that you'll be in hospital for 2 nights after the operation. The first morning you go down for an X-ray and a CT scan. We check that the prosthesis is in the correct position. I will normally send you a little video of that showing you the X-rays and the prosthesis. You'll get that in your emails. And then you see the hospital physio on the first morning, and then second morning you'll again see the hospital physio, and you'll usually get out about 10 a.m. You're then asked to be in a sling for 3 weeks and to wean out on the 4th week. And then I see you at 6 weeks and 12 weeks post-op, usually with Lucy or one of the other physios from Extend. And then we will both write back to your own physio, and your physio will get a copy of the operation notes from the actual theatre, plus you've got the video where I go through everything with the your X-rays and what we did in theatre, so you can share that with your physiotherapist as well. Weaning out of the sling.
Yes.
What are the tips there?
Everyone's normally pretty happy for that. So normally around week 3 to 4, you're safe to come out of your sling and start using your arm for all your light day-to-day activities. So start using it to eat and to wash and to dress and to groom, those kinds of things. So we start the arm moving. We don't want you to lift anything heavy yet, but just getting it going, getting your arm swinging when you're walking, just starting to use it for your normal day-to-day things. You don't have to wean it, cold turkey straight away. You can spend some time if it gets a bit tired or your arm feels like it wants a bit of a hug, you can pop it back on, but you're safe to come out of it as much as is comfortable.
Yeah, I think that's a good point. If it's super sore, rest up in the sling, but you don't need the sling at that stage. So just feel it out and see how it goes. So sleeping?
Yeah. Yes. Again, being propped up is often more comfortable, but from week 3 you don't have to sleep with the sling. Sometimes people like just loosening the neck strap a little bit so they've got a bit more movement in the elbow, but you don't have to have it at all from week 3, and don't panic if you roll onto it.
And they could take that bolster off if they want to too, don't
That's
they?
That's right, yeah.
3 weeks.
Yeah, so if it's a bit more streamlined without the bolster, if you just want it on for when you're going out and about, if you're going somewhere that's going to be crowded.
There's a bolster that goes underneath the sling and it's got Velcro, and we'll peel off with the Velcro.
That's true.
So we covered all those things for the first 4 weeks?
Yep, and so then you're starting to use your arm for your light activities of daily living, and then you see us at week 6, and then we can start some formal active range of motion exercises from then.
So this is the phase 2?
Phase 2, getting the arm moving. So we encourage light use, and we give you a stretching program that helps move the shoulder in all different directions. The movements that we concentrate on first are flexion and external rotation, so we really focus on those. And then we progress that to moving the shoulder in all different directions that you'll need to function in your day-to-day life. As your movement comes back, some people's comes back very quickly, and some people haven't moved their arm much for years and years, so it takes a bit longer. But as your movement comes back, then we can start layering a little bit of strengthening on top of that. So we start with the strengthening of the external rotation and progress on to some more general conditioning. But yeah, it's the fun stage where you get to get it moving and start learning to...
And that is something we see, isn't it? Some people progress, people progress different at different rates to other people. And the ones that we typically see progress slower are the ones that have had a really severe shoulder, where the actual shoulder joint hasn't moved much, and they're probably using their scapula for most of the movement. Their deltoid hasn't done much, and their deltoid's weak. That will take months for that deltoid to pick up in terms of strength. But it does, and we'll see it pick up, and you'll see the difference between 6 weeks and 12 weeks when you come back for that time. And we just have to be patient and let that take its time.
Yes.
There's no need to worry too much, is there?
Absolutely not. There's a wide range of what's normal, and you and your physio will be able to go at a speed that your shoulder's happy, and there's no set time frames. You just want to, go at the speed that...
Yeah, some people have it all back by 6 months, and some people it's more like 12 months. It just takes some time. Shoulders can be slow, can't they?
Absolutely. Yeah.
All right, so the exercises they're going to be doing at 6 weeks?
Yep, so a full active range of motion stretching program, which we have great pamphlets for. And then we write to your physio and just let them know that they can layer the strengthening in on top as your range returns. And then another thing that's nice to talk about is sort of the expectations in terms of returning to sport and activities, any hobbies and things that they
driving.
have. Driving, yes.
So to put your mind at ease, by 6 weeks post-op, I think it's reasonable for most people to be back driving at that stage, particularly if you've got an automatic car and it's got power steering or it's not too heavy on the steering. That should be fine, around about 6 weeks post-op. And then fine from there.
Yeah, absolutely. So as long as you feel like you can get your hand up on top of the wheel, can control the vehicle safely.
Yeah, you've got to be able to control the vehicle safely, of course.
Yeah, no, it sounds good. And then a lot of people ask, what are the expectations in terms of will I be able to go swimming, play golf, play tennis, go to Pilates, go to the gym, all these kinds of things. And these are things that we absolutely aim for.
So these are things that they can start thinking about doing between 6 and 12 weeks, that first and second visit back to the office, can't they?
Absolutely, yeah. Just as it feels comfortable, if they have the range and the strength, then absolutely.
And what I say to people is, particularly, golf or a pastime that you've been wanting to do for ages. Some people, there are golfers there that haven't played golf for a few years, and so at 6 weeks they finally realise they can play golf. You can't play it every day. Just once a week to start with. The same with swimming, I think too. It's just get in the pool once, maybe twice a week. Go, feel it out. We don't want you doing lots and lots and lots of the same thing. The shoulder. The mechanics of the shoulder have changed completely, and the shoulder has to get used to the new mechanics, and it has to get strong by itself. And we have to get you to pace yourself for the first 6 months.
Very important, isn't it? Yeah, you don't want to make it sore. Yeah.
And if it gets sore, at no point is this that sort of a thing where no pain, no gain comes into play. Shoulders just don't work like that. If it gets sore and you push through that soreness, things get miserable for you, and very difficult, and then very time consuming to correct too, because we'll often be wanting to, it may even be that we ask you to put it back in a sling for a month or so if it gets too sore. So if it does get sore, rest up, take it easy, even put it back in the sling for a week maybe, and then start back on again, and come message back to the office too, so we know what's going on.
Yeah, absolutely. Yep.
So 12 weeks.
Yes. So by 12 weeks, we're expecting that you have pretty good active range of motion. You're probably still going to be a little bit tight with hand behind the back, which is traditionally a difficult movement for reversers.
I think, Lucy makes a good point. The reverse, we see most patients with reverse shoulder replacement, there's no reason why they can't get 180 degrees of elevation. So that 180 degrees is straight up in the air, so that's sort of abduction, up to the side and up to the front as well. Not everyone does. I think if you get 160, that's what I'm aiming for everyone. But certainly a lot of people, particularly the people that are more flexible, if you're a tight person, tight ligaments, you're probably not going to quite get that. External rotation is usually really good too. We want at least 30. It's nice to get 60 or more, and most patients will get that. But the internal rotation, so around behind your back, is something that classically the reverse isn't particularly good for. So most of our patients get that movement, don't they? But even if you've got really good range of motion behind your back, it will always feel a little bit weak, doesn't it? Is that a good way to describe what they feel?
Absolutely, yeah. They're often much better at doing it passively than actively. It just takes a little while. Yeah. That's one of the slowest ones to come. Yeah. Yeah,
so realise that getting a hand around behind your back will never be perfect, I think is probably the thing to say.
Yeah.
It's a particular thing with the reverse.
Yes. But it's an amazing rehab because these patients are patients that often get it done because they're still young enough to want to be active and get back into the activities that they love doing, and this allows them to do that. It's a wonderful journey.
Yeah, for most patients it's a life-changing operation. Yep. So 12 weeks, what are we doing?
Yes, so 12 weeks, so we expect you, to have good range of motion, but still be a bit weak, and so then we really focus on getting you as strong as you can from month 3 to month 6. So working with your physiotherapist on an individualised strengthening program that gets you strong for whatever you want to do. If it's golf, some golfing drills, swimming drills, just whatever you want to achieve, we can tailor some strengthening for that. But moving into more sort of general conditioning, returning to the gym, getting you nice and strong for whatever you want to do.
Yeah, right. And so from the 12-week visit, I will normally not see you then until 12 months, and then I see you with a CT and X-ray for a final review, make sure the prosthesis is bonded in, there's no issues coming up in terms of loosening or anything like that, and then I'm confident that you're going to be fine with your shoulder long term. But if you need to come back and see us earlier, certainly think of coming back and seeing Lucy and I at 6 months post-op and checking in then to see what's going on. You can just ring the office for that. But most people won't need to. Most people will be fine with their physiotherapist, and they've got a good relationship with their physio, and they're just going through the strengthening.
Yep. No, it's great. It's a really good operation.
Anything else for that time period, that 3 month through to 12-month period?
Just it does get a bit exciting when you start doing these things that you haven't done before or for a long time.
Yeah.
So just listen to it.
Don't we?
Yeah, just listen to it and just make sure you're not pushing it too hard.
And if it gets sore, I'll just reiterate again, if it gets sore, you need to slow down. If you push through that soreness, things usually get a lot worse. The shoulders don't like being pushed. You want to keep, if it's getting sore, particularly if you're getting sore around the back of the shoulder, slow right down and take it easy. It's just, there's a gradual process. It really can't be rushed too much, can it?
No, just listen to it. Yeah. Be in tune with your body.
All right. So that's rehab from us for reverse shoulder replacement, starting with the prehab, the preparation for the shoulder, coming up to the actual operation itself, what to expect for the first couple of days while you're in hospital, and then leading up, that first 3 to 4 weeks in the sling, then weaning out of the sling at around 4th week, and then coming to see us at 6 and 12 weeks post-op, and then there's just an outline of the strengthening from 3 months through to 12 months. So hope that all makes sense to you. Thank you for listening.
Thank you.